Hi everyone, and good morning. Thank you for spending your precious Saturday morning with us today. We will be having a webinar entitled Clearing Misconceptions About Rabbit Care. So whether you are a current rabbit owner or you're a budding rabbit owner, this webinar is going to be the right place for you. My name is Dr. Sean Sum, and I'm from the Animal and Veterinary Service. And joining me today, we have Dr. Cathy Chan from the Animal Doctors. Hi, Dr. Chan.
Hi, Sean. Hi, everyone. Good morning. I'm Cathy. I currently work at the Animal Doctors. And we have two places at Ang Mo Kio and Tiong Bahru.
Yeah. Great, thanks, Dr. Chan. And Dr. Chan is an extremely experienced veterinarian when it comes to rabbit care. And today we have the privilege to hear from her to share more about basic rabbit care and to clear misconceptions that we may have about rabbits. Later on, Dr. Chan will also be doing a live examination on one of our very own rabbits, Christoph. So please stay tuned for that. Now, if you have any questions for either of us during this webinar, do feel free to pop them in the comments and we will get to them at the end of today. If your question remains unanswered, don't worry. We will reply to you directly in the comments after the webinar as well. Now, I hope you're just as excited as I am to hear from Dr. Chan. So without further ado, I'll hand over to Dr. Chan to tell us more about rabbit care.
Thanks. Thank you, Sean. Hi, everyone. Yeah, so we decided to come up with this topic because rabbits are becoming very common as pets, well, the third most common pets. At our practice, we do see dogs and cats, of course, but rabbits do make up about 50% roughly of the number of animals that we see. With that comes people who have owned rabbits for the first time, or very experienced owners who've had rabbits for a long time and they've got second, third, fourth rabbits. So they're certainly very interesting creatures. They're smaller, they're more fragile, and there's a lot of information about owning rabbits out there. A lot of the time, people do think that rabbits are easy pets, or they're very safe and good first pet for a child. And so some of these things can be misconceptions, and we would like to clear that up today. So I came up with a list of about 10 misconceptions, and I'm sure there are more out there. But certainly if you do have anything that I've missed out on the list, you're quite welcome to put them in the comments, and we can try to answer them later on during the question and answer section. Okay, so excuse me. So I guess the first thing when we all think about owning a pet, we always talk about owning a pet being a commitment and a responsibility as well. And of course, depending on the lifespan or the average lifespan of this pet, that's how long we would have to be committed to its care. There are generally two guiding principles, I guess when I talk to clients or when people ask me, should I get a pet for the first time? Two main guiding principles that I like to sort of bring up. Well, the first is responsible pet ownership, and you hear that a lot. You hear that people say that. You hear that as a slogan, as a thing. So what does it actually mean? What does it actually mean to take responsibility of something that you're about to purchase or about to adopt? And how can you bring that responsibility into part of your daily life? That's the first thing. And the second thing is also the welfare, right? I mean, we want to own a pet. We want to keep it as happy as it can and want to give it a good life. And what do we mean by animal welfare? It's such a broad topic. It's something that many people have different ideas about as well. There's no right, there's no wrong, and everyone has their own standards too. So a lot of the gold standard of what animal welfare is what we call the 5 freedoms. And in vet school, actually, the 5 freedoms is brought in when you're first year of vet school, even pre-vet, where you first think about getting into an industry of owning an animal. What are the 5 freedoms of an animal? And when you take on the pet, and when you go through this talk, or when you think and reflect on your own pet and what you have and your decision to own one, is whether you can actually provide these 5 freedoms to your pet. And if you can, then more or less you're being a responsible pet owner. So the 5 freedoms are generally defined as, well, number 1, a freedom from thirst or hunger. And some of these things may seem quite, quite common sense, if you were, to some people. But actually, sometimes you might know it, but it might be very difficult to apply, especially apply to your daily life as well. So the first freedom is quite self-explanatory. It's a freedom from hunger or thirst, which means obviously that you should be able to provide food and water to your pet. The second is a freedom from discomfort. So providing an environment where your pet would be able to live comfortably. The third is freedom of pain, injury, or disease. And of course, here's where the vets come in, right? I mean, that's what we traditionally know our vets to be medical providers, to be the doctors for our pets. So the third one is where the vets do come in. But also being a responsible pet owner is noticing that your pet is sick or behaving unusually, maybe injured, or perhaps having some clinical sign of disease, a snotty nose or teary eye, and taking that responsibility to take them to a medical professional for help. And the fourth is the freedom of fear and distress. So this one also is quite, in a way, self-explanatory. The animal should be kept in an environment where it shouldn't be in fear or in, of being traumatized. Yeah. And the last is quite a tricky one. So the last, instead of a freedom from, is actually a freedom to. So this one was added in a bit later on to the 5 freedoms. And this one actually embodies quite a lot of how an animal should be kept in the long run, in the long term. So the freedom to express normal behavior and the freedom to express a natural behavior. So bearing in mind, of course, when we talk about companion animals, these are animals that belong in a domesticated situation, in a companion animal situation, not animals that are still in the wild. But of course, they do have some natural behaviors which we want to try and encourage and try and keep as well. And how do we adapt that to a home situation when we bring them into our home to live with us as companion animals? So this one is tricky because it can be misinterpreted. And I think I have a slide later on to show you something on that, on how this last freedom can be misinterpreted. But also, we want to try and establish this because this is how we keep our animals truly happy, where they can actually express their natural behaviors and feel natural as well. Okay, so we go to the next slide. So the first slide I have is I call it, I guess, Mythbusters, and I have 10 of them. So the first thing, and these are things that we really see quite often, or we hear people say to us quite often. And certainly we do have, we work with rescue groups as well, rabbit rescue groups. And these are the things that they feed back to me as well. And I did ask them what was a good misconception, because they hear a lot from owners too, or potential owners, and what people think. And this is one of the first ones, that even before we actually have the rabbit or purchase the rabbit, that people think that rabbits are very good starter pets. So starter pets is a bit of a funny thing when we get people to think about, well, when is the right time to get a pet? Often it's when people often make that decision when their children are becoming a little bit more responsible, maybe a bit older, and want to take on some responsibility, and we want to teach them some responsibility for caring for someone else, for something else other than themselves, for some empathy, for example. So usually we would get inquiries or questions from people who think that these are the first good family pet, or rabbits are good starter pets. Usually it's because of a misconception that the rabbit is smaller, or maybe require less care, or maybe doesn't live quite as long. Various things. So we'll go through that a little bit. So this is one of the biggest myths that we do see. People think that rabbits are low maintenance pets. So this is the other thing. But I guess I want to address that if you're starting out a decision to own a pet with these questions already, that's probably not the right place to start. If you're trying to go into owning a pet and trying to find the least maintenance pet, it's probably not the right way to get started already. So the main thing is to go find out what these animals do need. We do see that a lot of these pets, of course, why children are often very drawn to rabbits, and even adults as well, is because we've had them, we're very familiar with rabbits. It's always in our daily, we see it on TV with the concept of having the Easter bunny, and next week's Easter already, coincidentally. And unfortunately, we do see a big rise in purchasing of rabbits during the Easter period. And it's just one of those things, I guess, it's all ingrained into what we see and experience in our daily lives as well. And so do our children. You've got your Easter bunny everywhere during the Easter phase. And how did the Easter bunny even become how did the rabbit even become part of a religious celebration as well? So that's very interesting, and I did a bit of search on that. And also, how did it link even to chocolates and food and things like that? So the interesting thing was that in the 1700s, people used during this Easter period to celebrate, and they used to use eggs, and I guess they hunted rabbits in the past and hares, wild hares, and used this as a token to exchange for goods or to pay off their dues in the village, And so from that it came and it was brought into America in the 1700s by the Germans. And this is where, the concept of having the bunny or the rabbit involved in an Easter celebration where it's used as a currency basically, and related to food as well. And slowly it's become what we know as Easter bunny today. So it's become a big thing, and a lot of rescue groups would tell you that this is the time when, the sales of rabbits would go up, and shortly after you would see a lot of people wanting to give up their rabbits. So I guess needs of a rabbit, when we're dealing with rabbits being a good starter pet, I would have to disagree, because having experience and learning about the rabbits, they actually do require quite a lot to take care of them. It's not like they're low maintenance. There's quite a lot of not just financial commitments, but emotional as well. And of course, they are very fragile. So you got to be very careful when kids handle them too. That not to say that, there are people who, definitely if you're prepared to make that commitment, prepared to learn about them, get the whole family involved, they can be very, very good family pet if everyone is involved in the right way and taking the responsibility to keep them well. One of the most common things that people give up their animals for, and that's the top, give up their rabbits for, is actually being allergic to their fur. So a lot of rabbits are usually purchased as young rabbits, and then when someone in the household or children start to get allergies to the rabbit fur, this is when the rabbit's given up. So this is something that probably you want to have some research. If you have kids, then you're thinking of it, try to find friends, or there's a very big rabbit community, to find someone who can, your kid can experience playing with the rabbit for a little while, so you can actually observe how your kid would respond. And then you can make a very educated decision from there. Okay, so the second myth buster is that, the things that we hear is that rabbits don't live long and they are actually a short-term commitment. So actually rabbits live a lot longer than people realize. We always get this sort of comment like, oh, how long can rabbits live for? And when we tell them actually an average of about 10 years, and you get a lot of shocked look on their faces. True enough, in the past, before we knew a lot about rabbit healthcare and preventative health, probably the average lifespan of a female rabbit would be between 3 to 5 years of age. However, with with us knowing a lot more about them, taking better care of them, sterilizing them as well, the average lifespan of a companion rabbit does increase to up to an average of about 10 years. So this is a 10-year at least, right, commitment if you're thinking of getting a rabbit. In the past, and I would say even about 10, 20 years ago, there was in the pet industry a bit of a mentality where it's called what we call a disposable pet mentality, where the smaller the animal is, the more sort of disposable you would think of it as. And a big example of that are the small mammals like hamsters and guinea pigs, where they are cheap to buy, and the mentality would be, well, if they get sick, we'll just either dump them, throw them away, or get a new one, right? That's a very common thing that we hear. I'm very thankful that now, being in the industry for about 20 years, things have changed, and the modern Singapore attitude to owning a pet is very good. Certainly we do still see this disposable pet mentality, but it's getting less and less. And I think we all of us in the pet industry really work towards trying to prevent that from happening. Okay, so again, before you're making this decision already, if the thought ever crossed your mind, if you found yourself falling into this disposable pet mentality, then I would say this is not a good place to start as well, okay? And to move away from that, and maybe take some more time to think about what choice you're going to make. The life expectancy of a rabbit, it depends on a lot of things. It depends on the breed of the rabbit as well and how you care for them. And of course, the big question a lot of people always ask me is, if my rabbit is this age, how many years is that in human years? So we get that a lot, even with dogs and cats. If my rabbit is 10 years old, what is the age in human years? I think in a way it's difficult. There's no real scientific correlation or how you multiply a mathematical formula and get the age in human years. But I think it's important because people want to know that so that they get a concept of whether their animal is young, adult, or geriatric, and what sort of care that they really need. So you'll see online quite a number of charts, of this is my rabbit, and this is in years, and this is how it is in human years. And it's a good indicator of whether your rabbit is a young, middle-aged adult or senior, but probably that's about where it ends. The real life expectancy of the rabbit depends on the breed and how you really take good care of them as well. And of course, with more vets taking on rabbit medicine, we do tend to see that we can help them with a lot more as well. Okay. The third one, that you also hear people say this, rabbits are very quiet pets and do not need stimulation. So this is where the importance of that fifth freedom that we talked about before comes in. So the fifth freedom, remembering, is to be able to express your behaviors, your natural behaviors in a certain environment. And this is important because if anyone who's observed rabbits or owned rabbits will know that rabbits are very inquisitive creatures. They're very curious creatures. That's part of their natural behavior. Their natural behavior is to burrow, to forage. What we mean by forage is to, nose around and look for food, and to dig. And of course, being in a home situation in a house rabbit, these behaviors can be very, very tricky. How do we encourage or provide the environment for these rabbits to have their natural behavior? So you can see some of the pictures there, and later on when we look at Christoph, we can show you some things as well. A lot of behavioral enrichment toys. So a lot of toys made up with safe material to eat, like hay. You can see on the top picture there, hay balls. You can even make them very cheaply by tying them up, putting them into disposable paper cartons, that sort of thing, just to make things more exciting. And some people would hide treats. And all this is about behavioral enrichment. Now, when people own rabbits and they say, oh, they're quiet, they sit in a corner, they don't need any stimulation, that rabbit is probably quite a scared rabbit, one that hasn't been very used to movement at all. And that's not really a good thing. Just because they are keeping quiet doesn't mean that they're enjoying the situation that they are in. So when you provide these toys, in the second picture at the bottom, you can actually see a very elaborate setup that someone has done, a beautiful elaborate setup for their bunnies. And there's even a climbing area, second level, and you can change this around. And actually, some rabbits would change it around for you. A lot of rabbits like to move their furniture around as well. So it's not true that rabbits are quiet. They actually do need quite a lot of time and effort and playtime as well. And they do expect that from their owners and people to care for them. So not just toys, but also time spent to take care of them. Okay, and the fourth one is handling. So, of course, we always see this very famous, concept or picture of magicians pulling rabbits out of hats, and also pulling them out of hats by their ears, rabbit handling is one of the biggest injuries we see in the vet clinic. And I guess now we know a lot of education has gone into it, that you shouldn't be holding anything really by the ears. And because rabbits have such long ears, it's actually easy. It's actually quite an easy way to restrain them. But definitely you can see logically that is really painful. And you cannot really hold something up by the tip. They'll be swinging at the bottom, and with gravity they could really hurt themselves. We see a lot of fractures and injuries from handling. Not that so much that it's on purpose or improper handling. A lot of it comes from not knowing that that's not the right way to actually hold the rabbit. Rabbits are difficult to, not difficult, but rather it takes time and what we call conditioning to get a rabbit to be able to be picked up. When you first purchase a rabbit, not all of them are automatically, will melt and sit in your arms and lap and cuddle. That doesn't really happen. You need to condition them into handling them safely. So we often actually see a lot of these traumatic bone injuries from people who are new to handling rabbits, or rather were not aware. So usually what we would always say, and we can show you a little bit, there's some pictures here, but we can show you a little bit later with Christoph, and how we always hold the bunny close to your body, always protecting the back and the lumbar spine. And you see in the last picture there that there is this position that you can hold a rabbit, and it's called trancing. So this is when the rabbit is actually held on its back for a period of time. And what happens is quite natural physiological process in the rabbit is that everything tends to slow down when they're put on their back in this way. And that's why they seem to go into a trance. Their heart rate drops, their blood pressure drops, and some of them can actually appear that they're in a daze. This is actually not the recommended way that we would say to keep the rabbit in, because you can actually drop their blood pressure so low to a point that they cannot recover from it. So usually this trancing technique or trancing handling is really reserved for the vets when they're doing specific examinations, or when you really have a situation that calls for it. And I would certainly say that this is something that only the professionals should attempt. You will see it, and why I mention it is because you will see it online and on the internet that it's something to do and how to get your rabbit to behave, but that's certainly not something that we want to happen. Okay. So this is just some x-rays of broken bones. Unfortunately, broken bones in rabbits are tricky because, if you have a broken bone, it's easy to think, well, we'll just fix it. Well, it's easy that way, but if you think about, trying to fix a bone that's maybe only half a centimeter in width, so you're trying to fix maybe a chopstick, right, together, and that's not easy. That's really quite tricky, quite technical, and sometimes they can break spines or dislocate limbs as well quite easily, just with gentle handling even. And so, it can be quite traumatic, and it can be painful, of course. And, the owner will usually have to make the decision of whether they would proceed to fix something like that or not. So proper handling would always be the first thing to try and prevent these situations from actually taking place. Okay. All right, only at number 5. Okay, number 5, we got 10. So one of the things we do here as well is that rabbits do not need much room, and they can live in cages quite comfortably. So this is one of the things that, again, I think it's good we are moving away from in the last 20 years. I think even when I was a kid, you will see a lot of rabbits kept in cages, and thankfully we know more about them and what they need, and we're slowly moving away from this caged up rabbit sort of scenario. And I think just always going back to our 5 freedoms of animal welfare, being the gold standard of animal welfare, keeping a rabbit in a cage like that, you will already see how we can, violate many of those 5 freedoms. Often rabbits, if kept in cages, food is just pushed in, and they do poop a lot, okay? And if they're not cleaned out thoroughly enough, it can be it can get quite dirty quite fast. And you'll see a lot of these cages have bars or grills as the flooring as well, and often the rabbits are not able to walk naturally or walk properly on these grills. And of course, our 5th freedom of being able to move freely and exhibit normal behavior will definitely not be met in situations like that. So we do recommend, a lot of the recommendations of the welfare groups and also the veterinarians is also to keep them in playpen situations. Of course, realistically, you can't really have rabbits, some places you cannot have rabbits roaming around, so we have to adapt to what the home situation is, providing the playpens, or if they are in the cage, making sure that you get sufficient playtime outside as well, and making sure that the cage is extremely clean and spotless. Okay, so here we have nice elaborate playpen type settings where you have nice good room, you've got a litter box for the animal to pee and poop, you've got your food and everything. So it's quite I guess it's doable. So you do need to have a bit of a space even in a home situation to achieve this. Okay, number 6. That rabbits are affectionate and they love cuddles and they do not scratch and bite. So now we go on to the flip side. We have this idea that rabbits are always very cuddly and very fluffy, nice to handle. But, some of them can be quite stressed, and in stressful situations or because of hormones, they do bite and scratch, and they can inflict some wounds. Of course, they are small animals, so generally the wounds may be small, but they still can be quite painful and get infected. We do get rabbits that also chase and herd their owners, nipping at their feet as well. So all these things, we have to think about and consider. The first thing usually is always hormone related. So generally, we try to advise owners to encourage sterilization because that helps with the behaviors, and also the enrichment, right? So a lot of rabbits that do not get proper environmental enrichment would start to exhibit these. They will start to act out basically, and start to act out on their owners as well. Okay. And number 7, that rabbits stink and make a big mess. So sometimes you might hear this, that beforehand, before you get a rabbit, oh, should I get a rabbit? Well, they really stink and make a big mess, so you don't. Well, I would have to say that rabbits have a very fast gastric transit time. They're very unique animals with a very unique gastrointestinal system. So whatever they eat, and then it comes out at the back end as well. So you can have a big transition from a completely clean environment to a messy environment, even within 12 hours or 24 hours. So what does that mean? That means that as an owner, you got to really be prepared that owning a rabbit would mean that you would have to be cleaning twice a day, okay? And maybe even really doing a big overhaul. It's not just spot cleaning, you really have to probably clean up everything. If the rabbits made a mess, they've arranged their furniture around, you probably have to rearrange that as well, okay? So it's not that they, it is true that a lot of things with the rabbit's life moves a lot faster, but it does mean that as owners, taking the responsibility to keep the environment clean and enriched, that we would have to be prepared to clean out their environment twice a day. Now you can see, I put that picture there because on the slide, because you can see the top picture is the nice clean one. The owners just cleaned out everything, ready to go for the day. And 12 hours later, the second picture, you have a soiled litter tray, completely soiled, food and everywhere, vegetables finished. Rabbits are happy. I mean, I think you can enjoy the rabbits are quite comfortable and very pleased with what they've done to their environment. But now the owner will have to go in again and clean up again. And this will happen every sort of 12 hours. So you do always hear very affectionately a lot of rabbit rescue groups, and the owners would term themselves as bunny slaves, because literally what they feel like they're doing all day is cleaning up and helping their bunnies out. Okay, next one. Okay, number 8, that rabbits can live on carrots and green beans. Again, with a lot of sort of education through the years, this is moving away. We always think about rabbit feeding as what we call a food pyramid for the rabbit. And at the top actually is the smallest amount of food that you need to feed them, and that's basically where carrots are and green beans are. And they usually use as treats. So I think, when we think about feeding our rabbits, we know that they eat a lot, they eat all the time. But we want to feed them what they should be fed. So bottom of the rabbit feeding pyramid would be your hay, and that's where you give the most of all the time. And then you've got your leafy greens and your pellets on the top, and finally your treats. And this is where actually carrots and green beans come in. If given a lot, your rabbits, for example, given daily or a lot of carrots and these sort of very sugar-loaded vegetables, you would get rabbits that potentially have gut problems, bloat, and they will be making very many trips to the vet. So we really want to try and encourage them to be fed hay and vegetables as well. Okay, so the golden rule is generally, if you're thinking about feeding your rabbit vegetables, is green leafy vegetables. And luckily, being in Singapore, we've got a lot of green leafy vegetables. They usually call it Asian greens if you see it on websites and articles. And that's where, that's our golden rule. That's what we like. Okay, coming to number 9. So this one is starting to go into a lot where the vets do come in, right? So a lot of things that we do here is that my rabbit lives alone and does not need to be sterilized. So for female rabbits, the lifespan dramatically increases to 8 to 10 years from 3 to 5 years old when they are sterilized. I mean, sterilization is not just mainly to prevent breeding, but also we think about it as preventing behavioral problems and also medical problems. So many of these rabbits by the age of 4, about 80% of female rabbits will start to develop medical conditions with the uterus, and we do strongly recommend that they get removed. Some of these conditions can be fatal as well. Okay. Now we do hear a lot about rabbits, people saying, oh, we want to leave rabbits in their natural state. This is something that I hear a lot. Want to leave them in their natural state because they're animals. Well, I think, you need to think about being in a natural state versus now that you've brought rabbits into the domesticated situation, into the companion animal situation. They're no longer in a natural state. And keeping an animal that's not sterilized with raging hormones enclosed will actually come up with a lot more problems than you know. And finally, the rabbits do not need to go to the vet. Again, we do know very much that as medical professionals, we're here to provide that service. Rabbits do get sick. Doesn't mean because they're small or they don't say very much that they don't get diseases. Every living thing gets diseases at some point. We now know that there is a virus called the rabbit hemorrhagic disease that's in Singapore as of 2020. So we do need to vaccinate our rabbits as well, and that's done yearly. So we go to the vets for that. We go for wellness checks, health checks. And importantly, this is the point of time when you can check in with a vet to discuss about your optimal care and husbandry. The vets will be the best person to stand there and tell you very honestly whether you're meeting all that 5 freedoms for your pet. And you can discuss how we can achieve that. Of course, there's any medical, surgical intervention. And I guess the vets want to always play, we know that we can provide that essential role to ensure the longevity and wellness of the rabbits. Okay. And lastly, I guess we come to the last slide already, is the financial commitment to owning a pet. I didn't really put this as sort of a myth buster, but sort of something that as responsible pet owners, before deciding to go into owning a pet or a rabbit, what your financial commitment could be. This is derived from one of the rescue groups, Bunny Wonderland. They've got an online free rabbit pet guide. It's very comprehensive and really good. And it breaks down a little bit about what the financial commitment, how much to start up, what to buy, how much potentially initial medical costs could be, and an estimate, of course, they've got there as $35,000 to set aside. So it's nice. We do now hear of people who set aside a fund for their rabbits. And it's good because I think knowing about this, people can make informed choices and decisions as well. Okay, I think that's really what I have, and I'd like to thank quite a few people, Impacts, of course, AVS and Sean, my lovely host, and all the rescue groups that we have learned so much together, being in the forefront of rabbit care and medicine in the last sort of 20 years. And also the link to the Bunny Wonderland, I think you can easily search it. It's a rabbit care guide. And whoever's thinking of owning a rabbit or have one, that's a really good care guide to go to. And HRSS has one as well. Yeah, so I think that's all I have. Very short time, but...
Thank you so much, Dr. Chan. That was amazing. You brought us through so much information, and I've certainly learned a lot. I'm sure our viewers at home have as well. And I think what we can gain from this is clearly owning a rabbit is not just a lifelong commitment; it's a big commitment.
Yeah.
And there's a lot of steps involved, and you've shared just the tip of the iceberg with us today.
Yeah.
So hopefully, for all of you there, whether you're current rabbit owners or thinking about getting a rabbit, these are important considerations to bear in mind. So, Dr. Chan, we'll now be moving on to the next section of the webinar. And I hope you're all excited because we're about to examine Christoph. And
Christoph.
He's a really cute, fluffy bunny. So just hang tight with us. We'll be back with you in a minute, and we'll see you shortly.
Great.
Hi, everyone. So welcome back. So like we said, we are just about to do a live physical examination on Christoph. Christoph's just hiding now. He's probably a bit camera shy, but you'll see him shortly. Christoph is one of AVS's very own adopted rabbits, and he's been with us for the last few years after his previous owner had given him up. You've already heard Dr. Chan share that rabbits can live up to 10 years or even older, so Christoph is actually quite a senior rabbit. You've also heard Dr. Chan share the importance of visiting a vet, so we'll shortly hear from Dr. Chan what you can expect when you bring a rabbit to a vet and what they're assessing when they do a physical exam. So, Dr. Chan, do you want to guide us through how you're going to do a physical exam on Christoph?
Christoph is just chilling in his little box here, having a bit of munch on his hay. So, I guess we can bring up a little bit about the environment that they've set up. I mean, this is obviously his setup in where he is as well. But a few things that we have, definitely you can see he's got his mats as well. So, the flooring is important. Even though we've got tiled floors, it can be quite hard and there's not much natural, sort of sponginess to the floor. So a lot of non-slip spongy mats are very helpful for bunnies as well. And of course, we got this beautiful playpen situation that is keeping all of us in this playpen. And depending, these playpens obviously come in pieces, individuals, so you can set them up to suit your house. You've got a litter tray here, so Christoph is very well litter trained, so you can train your bunny to pee and poop in the box. And you've got the enrichment, so he's got a little shelter. That's one thing that's important as well for bunnies, to have a little place to hide in when they feel scared or stressed or anxious. They can go in and hide in a box as well. I think he's not so stressed and anxious. He's just chilling. And then you've got toys, so you've got your little sort of straw carrot there, and he's got obviously his food as well. He's got his vegetables, he's got his good mix of vegetables which he's munched on. You've got your pellets, you've got a few treats there, and his hay is in a hay box that also can serve as a bit of enrichment too. He can play around with it, he can go in, find things, and he's got his treats lying around. And one good way to exercise a lot of your bunnies is also to hide treats in their area so that they can forage. You remember that natural behavior of looking for something and foraging is actually really important for rabbits. It's really a big part of how they behave. So hiding these little treats can encourage them to go and dig around for it and spend their days with different activity. Okay, so I guess the other thing also we quickly mentioned, or that just now with the thing, is handling, with our slides, how we handle a rabbit. Now, meeting Christoph for the first time today, but obviously, he's very calm rabbit, and we can read them. Some rabbits are very anxious, very nervous, very stressed. And if you push forward with a physical exam with them, they can often get really, really unhappy, and they can kick and really hurt themselves. So a lot of the times we have to read the situation. In a consult room, usually I have a table and have them on the table. But of course, if we see that the rabbit's very jumpy or very stressed, then we might come down to the ground where they feel a lot safer as well. So we'll bring everything down to the ground and we'll do the physical examination actually on the floor, which is what we're doing today. So I'll just, instead of pulling him out, I'll just lift the, lift the house.
Show now.
Now it's his turn. So of course, when we first approach a bunny, the thing to always remember as well is that rabbits are prey animals, or they, in the wild, they would be prey animals. So they're the bottom of the food chain almost. So if you go to a rabbit and you sort of suddenly approach it and grab it, that is literally what their instinct would tell them to do is well, there's flight or fight. They wouldn't fight because they're herbivores and they're prey animals, but they would either dash away and run, or they would actually become like a brick and become very, very still. And that's how they respond if a predator was to come at them. So I guess always the important thing is like how, you always learn that when you approach a dog, you always try to approach gently and try to give a sense of familiarity first. So with Christoph, he's quite used to being handled. I think, where he is, he's handled quite a bit. So he's quite happy to be stroked and patted. I wouldn't go in and quickly just grab him, even in a consult room. So just by looking, when we do the consult, we visually obviously look at them. We see that he's in very good body condition, means he's eating quite well. His fur and general body condition is clean and nice, okay? And then usually I would then try to pick them up. So I get them a bit used to it. If rabbits are a bit unsure about being lifted, then I'll keep them to the ground. And I'll just get him used to the fact that I'm there and that I'm actually going to pick him up, okay? When we first have rabbits that are not used to being picked up at all, I tell owners, you do this very, very slowly. You condition them over 3 to 6 months. The first month, maybe all you do is just this, that's all you do. And then you give them a treat after that, or you're happy, and they like being groomed. Remember, rabbits are social animals. They live in groups, okay? And they love grooming each other. That is actually a natural behavior. They love grooming their friends, they love grooming each other. They clean each other's nose, ears, everything, if you actually observe them. So the idea of having their owner or their bonded person or friend do the grooming is actually quite comfortable for them. he is very good because the moment he feels you stroking him, he kind of melts and goes into this, like, you know.
I think you're just natural.
Yeah.
He's ready for another snooze.
So then after that, usually what we do, so in the consult table, what I would do usually start from head to toe, right? So usually we would feel, and rabbits get dental disease a lot, so we feel for their pain or discomfort up here where their dental roots are. We feel the bottom of the jaw, the top of the jaw. Okay, we usually look at the eyes, you know, checking for things like eye conditions, cataracts, and then of course we look at their ears. Many of them have ears that, the bigger they are, the more infections you can get, right? So we look in the ears, you know, look at how the condition of the ears. And the one thing about rabbits and their ears is that majority of rabbits' ears have a very big and what we call very vascularized. So they've got very big blood flow going into the ears. So actually just by looking at them, sometimes you can tell if the rabbit is sick or not. You can feel the ears as well, whether they're cold, they're warm. Rabbits in shock usually have very cold ears, so you can also feel that too. And then we also look at the general fur, obviously, whether they've got any parasites, any fur mites, okay, anything like that. And then we go down to actually feeling the belly. And feeling the belly, we can feel all their intestines, their stomach, their cecum, and sometimes their kidneys as well. And during this time when I feel, I can also feel whether this rabbit is skinny, whether he's losing body condition and he's unwell. And of course, at this time, we also have a listen to their heart with the stethoscope, right? So we can just put that on there. And I will usually just gently lift them off the thing a bit. Okay, and we listen to the lungs as well. Now, when we do this, you can see how when we're handling, if the rabbit was really scared and would start to kick and run away from me, that's okay. And I would just let that happen because, you know, if you try to withhold them or restrain them too much, he can kick against you and he can really hurt his lower back. So rabbits, why they always hurt their back is because they have a very long, what we call lumbar spine over here. So just like us, you know, if we suddenly did a kick or overextended our back, you can quite easily break the spine over here, the bones too. So the next step after I've looked at the rabbit from top to bottom on the top, we want to have a look at the underside. Now I mentioned before that we only reserve trancing. Remember what I said, trancing for very special situations because that can actually put the rabbit in a bit of a distressed state. But I will do the not trancing per se, but I would put them on their back for very quickly for a short while, just to have a look at the underside because that's pretty important. So usually I would hold with the front and then really support the back. I'll use my palm of my hand to support his lower back so that he's not able to kick. And I would lift him very quickly onto my body. And so if he did kick backwards, he would be kicking onto my body. And the closer he is to me, the less insecure he would feel. So that why rabbits tend to feel insecure and start to move is usually because they are feeling like as though they're free falling, and that's not so good as well. So very quickly, I have him on his back. I don't like putting them all the way to the back, just upright like this. And we can look at his underbelly. You know, we can look at his perineal area, the groin area. We can check the bottom of his feet for sore hocks as well, and sores in the front paws as well. And we can have a quick look. And finally, we can also have a look at their teeth. Rabbits have 28 teeth, so they got a lot of reasons for teeth problems. So we would look very quickly at the incisors. I don't have my scope today, so I can't look at the back, but after I check the front teeth, we would then put a little scope in to check the back teeth as well. Okay? And then very quickly, we will put him back up like this. So even though the physical exam might be quite quick, but we do get a lot of information from the physical exam. You know, we try to check everything as much as we can, and then we will get an idea also with the stethoscope of gut sounds and how the intestines are and things like that as well. So yeah, so after that we would put them back down. And of course, we would take their body weight as well, which you don't have a weighing scale, but the body weight generally for us to see how they're progressing. So yeah, so he's gone off. He's like, enough.
He's enjoyed that massage.
Yeah.
No, that was perfect. Thank you so much for taking us through that.
Yeah.
I mean, you shared earlier that you would recommend for rabbits to be taken to the vets on maybe an annual basis or regular health checks. And I think you've just seen what Dr. Chan has done, and she's made it look really easy, but I think
it's usually longer than that. I mean, of course, there's a lot of questions, and the vets will ask, how you keep the rabbit and questions as well. And this is the time actually where you can get your information on husbandry, how you keep your rabbit, and we would see it reflected in the medical condition of the rabbit. And sometimes we can tell. If we see that the paws and the perineal area full of urine and feces, then we'll definitely advise you on that as well.
Yeah, and Dr. Chan, you just mentioned about husbandry, and you were talking us through a bit about the environment, and Christoph's got a nice, cozy enclosure. I'm a bit envious of this, but do you want to talk a bit more about nutrition? I know you shared earlier about how hay is the foundation of it, and then we can have treats at the top. So maybe talk us through a bit about the different kinds of hay or different kind of vegetables and the nutritional differences that we might want to know.
Yeah, I mean, definitely with the unique gastrointestinal system with rabbits, they have, I guess, a very big, what we call a big hindgut, and the hindgut is the cecum. And this is a place where a second digestive process happens, which allows them to eat this sort of very fibrous food. So they've got sort of two, if you think of it as very simply as two types of systems. One is your simple digestive system that we have, your stomach, your small intestines, what you eat gets digested and it passes out as poo. But for rabbits, they have a second round of digestion where it's a fermentation process in the cecum. And this is a place where a lot of rich bacteria, a lot of nutrients that they can actually make and digest, like vitamins as well. So you would actually see that rabbits have two kinds of poop. One is a normal, round, hard, golden poop. He hasn't done any yet. The other is what we call cecal poop, which is softer and smells very much like fermented wine, I guess. And the thing is, you don't really see that because that poop gets eaten back, and they practice this where they would eat again the cecal poo, and that actually is very rich in vitamins and things like that. So the hay is important for various reasons. The hay provides the fiber for the rabbit to keep this gut system moving and keeps them going healthy. And the more hay they eat, the better the movement of their intestines are. So in rabbits, and you wouldn't see problems with food reflect so quickly. If you were not providing a good diet for the rabbit, actually the problems arise later on. They arise months to years after. And once they do, it's very hard to backtrack. It's very hard to change things. So the important thing is to get the diet quite right in the first place. Also, they're very used to, very accustomed to certain things when they're young. So if you have a young rabbit, giving them the right diet is important, because by the time you try to change things, they've already, they cannot change. It's not. Right. They don't do that. So hay is most important. Mm-hmm. And then the vegetables obviously provides the water and the nutrients. And you've got your pelleted feed. So the pelleted feed is important in a sense. It does provide the well-balanced nutrition, but it needs to be given in smaller amounts as compared to that. So actually this pyramid amount is quite good. A bit too much pellets, but I think that's just to keep him entertained.
No, that was amazing. Thank you. And I think it's amazing that so much goes on in such a cute little fluffy thing. And I think that's important for all new rabbit owners and even existing ones to think about.
Yeah.
So you know what, Dr. Chan, shall we move on to the final section of today where we can answer some of the questions that they've left us in the comments?
Absolutely. I think he's trying to tell me something. He's trying to communicate.
We should leave Christoph to take his afternoon nap, shall we? So we'll be back in about a minute and we'll see you to answer some of your questions. Hello and welcome back. So we're now at our question and answer section. So Dr. Chan and myself will try our best to to address some of the questions that you put in the comments. And I see that, there's so many of you here today. We're really excited, almost 150 of you, and you've left us brilliant questions. So just keep them coming, and we'll do our best to answer them. Like we said, if we're not able to get to your question within the webinar today, don't worry, we will reply you directly in the comments after. So shall we get started, Dr. Chan?
Sure.
Perfect. So we've got our first question here from Stacy. So the question that Stacy is asking is about EC. So we're going to assume this is about E. caniculi, which is a type of parasites that rabbits can get. So her question is about, will long-term medication for rabbits result in actually resistance developing when you're trying to treat such a condition?
Okay, so E. caniculi, or EC, I guess, is in short form, is quite a complex disease, right? It's a tricky one. It's hard to truly diagnose. We know it's endemic in Singapore. We know that a large proportion of our rabbits do have it. Very unclear where it's from, very hard to answer those questions. Equally, the treatment of EC or the management of EC is as complicated. There is no set treatment regime. If you think about things logically, of course, using something in the long term, developing resistance is the natural way that a parasite survives, right? If you think about how parasites, bacteria, how they behave, is if you put a certain pressure on them, maybe using antibiotics or antiparasitic drugs, over time, the organism will evolve and develop resistance. And that's just the way it is. I mean, that's Darwin, right? That's life. So if you ask directly, the theory is always, of course, yes, there is always a chance that something that's been exerted a certain pressure on with drugs will develop resistance, then yes, there is, it's true. Whether or not it applies directly to EC, it really depends. The treatment regime for EC really depends on the rabbit, whether it's an acute or chronic infection, whether they're housed singly or in a group. So a lot of factors, which I think, you really need to discuss with the vet specific to your rabbit, how to manage the treatment.
Cool. Thanks, Dr. Chan. I mean, we've gone with a really difficult question for you at the start, but thanks, Stacey. I think we can all agree resistance is quite a pertinent issue, so it's great that you brought that up. So we'll move on to our next question, and this is from Dia. So Dia's asking a little bit about how we can condition the rabbit to be better handled. So you've seen Dr. Chan just show us a little bit of how she handled Christoph, and she made it look really easy, but I guess, that's not always the case with everyone's rabbit. So perhaps you can share some tips on how you can condition your rabbit to handling?
Yeah, I think it's quite common. I don't think this is the only thing. Rabbits in general, like I said, if you think of them as prey animals, they don't like to be grabbed or picked up, or that is actually quite a show of aggression to a rabbit to actually go and try and approach it and suddenly try and grab it. So a lot of it is this conditioning thing. A lot of it is getting your rabbit to like to approach you. Maybe if it's food driven, you would have to use a bit of treats. And the thing is taking it slowly over a period of time. So very much the stroking, the treats, and then grooming again. And sometimes even just picking up the front and putting the rabbit back down, picking up the front and putting it back down, and doing that over a period of time. Maybe do it 4 or 5 times a day, and then slowly increasing. And then the next step is to pick it up with one hand from the front and just place your palm on the back, just like this, and then doing it again over and over again over a period of time. And sometimes conditioning them can take 3 to 6 months. Of course, if your rabbit's not sterilized, generally they are less amenable to handling. So sterilization is important to remove those hormones. And then a lot of play and bonding. So rabbits are good with bonding with their owners and bonding with their fellow rabbits as well. So when they bond and trust you, then of course that happens. I mean, if you think of it from the rabbit's point of view, if every time it gets picked up is to trim its nails, then to them that's quite, there's nothing in it for them. It's just picking up, trim nails, and then put it back down. So it can be quite scary. So it's about conditioning, getting the rabbit used to being handled, not just for nail trim, for everything really.
All right, thanks, Dr. Chan. And that sounds really sensible, but it also sounds like you need a lot of patience, really. And
that's right.
I think it goes back to what Dr. Chan was saying at the start, that it is a lot of commitment, I think, to taking care of a rabbit, and I hope we can all better appreciate that. So thanks for that, Dia. So the next question comes from Julia, and the question is, asking if she needs to provide a home or hideout where rabbits can sort of seek comfort from, as opposed to letting them free roam.
Yeah, free roaming is good ideally, but it needs to be in a home that you have truly bunny proofed. So it's like baby proofing your house, right? You need to bunny proof your house. So the big thing about free roaming rabbits is wires. They love chewing wires. It's great fun. Electrocution, we always see them in the clinic as well. They've gone through something, they've gone through why. And never underestimate a rabbit, right? Because they can bite through and they can go into places that you never thought that they would go into. So really bunny proofing the house, making sure it's safe as well. And yes, providing a shelter is vitally important. I think in any situation, in any environment, indoor, outdoor, even the home environment. And if you don't provide the shelter, you'll find that your rabbit will find the shelter either under the sofa or somewhere that they feel most safe in. And of course, it has to be a hidey hole where they can really go into and feel that they're not being threatened. Again, this is a very natural behavior. Remember, not only are they prey animals, but they're burrowers, right? Rabbits live in burrows in the ground. So that's why they go in there for safety and for it to be quite cool during the day, and they can rest and know that they can rest in peace and no predator would come and get them. So it is important actually for the fifth rhythm to provide a natural environment for the hidey hole. And you can put some enrichment things in the hidey hole as well. It could be quite fun for your rabbit to hide things in there, things like that. And I think they'll enjoy it for sure.
Yeah, thanks, Dr. Chan. And out of the corner of my eye, I can actually see Christoph actually going back to his hiding hole. Yeah. So I think you're absolutely right. It's a natural behavior that they like to express. And thank you for the answer. So we've got an interesting question here. So we've got a question on whether rabbits could get COVID-19. So I'm sure everyone's interested to hear about this.
Yeah, I mean, from what we know of, all animal species has the potential to get COVID-19. COVID-19 is primarily a virus that attacks the humans, of course, but it can have transient infections in animals and the pets we have as well. We know that the disease doesn't come from the animal, of course. It comes from the human and it gets spread to the animal by the owner or by the human. And usually, thankfully, at this point of time, what we see is that it usually causes mild disease in animals and in pets. There is a question of whether animals can be carriers, I guess. Not carriers per se, as in they can cause an infection in the next person, but of course, they act as contact area. So if an animal, and even if an inanimate object was there and the virus was on the inanimate object, someone who comes along could then pick it up that way. So it's sort of more of what we call fomite transmission, or rather that the virus is on them. Not necessarily in an infectious way where they actually pick up the virus, mutates in them, and then they can then infect someone else. I don't think it quite happens this way from what we know at this point of time. But can your animal get it if you have it? The answer is certainly yes. But thankfully, the disease is usually quite mild. We don't we don't sort of test for it. Unless we have a true indication that the animal is truly sick from the virus, but we don't routinely test for it.
Right, yeah, that's really interesting, I think. And if you're a pet owner and you're worried about your animal getting COVID, or you've gotten COVID and you're worried about them getting it, the AVS actually has guidelines online on what you should do. So if you have a few lost, just do a quick Google, and hopefully that will be a great starting point for all of you. So thanks for that question. Now we'll move on to the next one. So we have a question from Raf. So the question is about nutrition again, and their rabbit is eating a lot more leaves compared to the stems. And so I guess the question is, how do they encourage it to eat more of the stems?
Yeah, actually, this is not a problem. It's actually normal. So you've got your herbivores, your omnivores, your carnivores, and rabbits are very affectionately known as leafivores. So if you observe rabbits in the wild, they only eat the leaves. So it's not something that's not natural. They actually, when they forage and they eat grass and leaves, they actually selectively pick out only the leafy portion. So actually, not eating the stems is completely fine. I know some owners will get very frustrated. They buy the leaves and it's just nicely eaten except for the stems. And that is actually a normal behavior. Your rabbit's completely normal. There's no need for you to encourage or push them to eat the stems. There's not more fiber in the stems than there are in the leaves. If you want fiber, you actually need to get them to eat the hay. Yeah.
Right. It seems like a rabbit can get away with just eating the leaves, but I think our parents would never let us off if we selectively just ate the leaves or vegetables. So that's interesting to know as well. So we have our next question from Joanne. And the question is, what is the best way to feed medicine to a rabbit that doesn't like to be handled and carried? So I guess we're going back to more about handling and conditioning a rabbit to
Yeah, I
self-medication.
think giving medication is always tricky, not just for rabbits, right? For all animals, even for children, you have to force your child to use medication. But yeah, it's obviously, when you get the medication, a lot of the times as rabbit vets, we try to compound medications to be in liquid form or in flavored form. You can, in terms of the handling of it, I do see people online and on, I guess when you do a Google search how to administer medications, I do see people putting the rabbits in a trance position and trying to feed the medications that way. So that would definitely be a no. I never ever sort of recommend holding the rabbit in a trance position for any feeding whatsoever. Rabbits do need to be upright in order to be able to swallow properly. You can flavor medications as well. And yeah, it's about conditioning, getting your rabbit to be well handled. Of course, rabbits learn very quickly, and I know owners who give after a few days and the rabbits literally run away from them, or the moment they see the packet out, they're like gone, you know. So it's not easy. It can be quite tricky, but yeah, trying to condition them to be used to holding them in a certain way. They do have what we call a diastema. So they've got front teeth and back teeth, but there is a gap in between, and you can usually fit a syringe in that gap to administer them the medication. You can flavor the tip of the syringe as well with, fruit juice or cordial, and then getting them to like it that way. And then any sort of feeding needs to happen very, very gradually, very slowly, small bits at a time, because feeding too much at a go, they can actually choke on whatever you're feeding. So that's important. Yeah.
Right, amazing. And I guess the best thing to do is to always consult your vet if you're not sure about handling your animal safely or to giving the medication.
Yeah.
So we have time for just one more question. I know that there's a lot of questions coming through, and I'm glad you all are participating so enthusiastically today. But like we said, we will get back to you in the comments directly after the session. So the final question for today is actually whether rabbits can have baths, and
Yeah. Well, this is a good final question because the essential answer is we don't recommend rabbits have wet baths as we know them to be, with water soaking them, shampooing them, for various reasons. One, it's extremely scary for them to have that done. It's not natural at all, and they would be extremely terrified. You wouldn't see a rabbit in the wild taking a bath in a pond or anywhere. Okay, it's not natural for them. They'll kick, they'll struggle, and you get injuries from that. Also, the way their fur is, some of them are double coated, some of them have a waterproof coating on the outside. Once they get thoroughly soaked, their fur can be very hard to dry. They'll get very cold, very sick, and also the fur gets very matted. And certainly a lot of them can actually, you do see situations where they can inhale the water and actually drown from wet baths. So cleaning is essential. Spot cleaning, you can spot clean them with wet wipes and things like that. Definitely groomers do a lot of what we call dry bathing, which is just combing out, brushing out with powder and a brush specific areas. So that would be what we would encourage. Grooming is important, so the nail trim, the cleaning is very important, and that's usually done dry. And definitely groomers. And HRSS does a service where the House Rabbit Society of Singapore does a service where they teach you, they educate you on how to groom your own rabbit, and also they provide groom services in the house as well. So you can refer to them. So you can always observe experienced groomers, see what they do. And go to rabbit-specific groomers as well, because they will never bath a rabbit.
Okay, thank you so much, Dr. Chan. And these are all wonderful questions. So thank you for everyone who has participated today.
Yeah.
Unfortunately, we've run out of time and we've come to the end of today's webinar. I've learned a lot and I've really enjoyed myself.
Good.
So thank you. Thank you, Dr. Chan. And I guess thank you, Christoph, as well for being
Christoph is
such
great.
a great participant today. Yeah, and thank you to everyone at home for joining us. So we hope you've enjoyed yourself and you've learned a lot. Until next time, we'll see you again.
See ya.
Bye.